As of right now, Prisma Health plans to drop United Health Insurance as a provider. They say it's over failed negotiations. To discuss this further, I'm joined by Dr. Spence Taylor. He's a vascular surgeon and also the former president of Greenville Health System, which is now Prisma Health. So let's just go over kind of what's going on right here with Prisma Health and this insurance company.
Well, first, Kara, thanks so much for having me. It's a pleasure to be here. And I can say this, that thank goodness I don't know the specific details of the negotiations, but I do know the generalities of the process. And as we've said to other folks and that we talked to, this is the corporate ugly side occasionally that medicine takes that unfortunately puts the patients in the middle. And these insurance negotiations, I like to think of them, or certainly when I was in executive leadership at Greenville Health System, is very analogous to a strike. It's like a strike. And everybody is kept up with, and I'm not sure where the progress of this strike is, but the Screen Actors Guild in Hollywood. And it comes down to a point where they can't figure out the differences between the people that are basically paying the workers and the workers themselves, and they go on strike and they put the customers in the middle of it. And in a business like Hollywood, I guess having customers having to look at reruns is one thing, but unfortunately in the healthcare business, putting the patients in the middle is really, really sad. And as a doc of 40 years, I always hated it. I really did. I'll say this, that almost always, and certainly when I was president, when I was in senior leadership at Greenville, they get settled. They will get settled, and almost always they get settled before the deadline. And I suspect this will get settled as well.
And right now that deadline would be the start of next year. So they say if they don't come to an agreement, a lot of people in Greenville area and beyond could have to change their doctors because of this. So from your personal experience as the former president of Greenville Health System, what could be your role, or what could be, some of the higher ups' role in this?
So I think one of the things we're doing is we've created a public benefit corporation called Integral Leaders in Health to help educate the patients around some of these topics and what they can do and how they need to respond when things like this happen. Our advice would be right now for this to keep your cool, that you're not going to lose your doctor, that there's a huge incentive on both sides to get this settled. Again, the sadness, to me at least, is that patient well-being oftentimes is the casualty of this, and people needlessly are in a place where they have to worry, and most of the time, and in my experience, almost literally every time, they get settled before the deadline. Stay cool would be my advice right now for folks, and just let it play out.
And I always thought it was bizarre that depending on what insurance company you have, a procedure can cost totally different. It can be a very different cost. Why is that? Why is there?
Right. So before me and you were being interviewed here, we talked about the medical finance is a big black box to most consumers, Kara. And it does not, medicine in terms of how people get paid or the hospitals get paid, doctors do not follow free market principles. It's very simply regulated by the government. It's negotiated by insurance companies who use the government standard scale in terms of pricing, and it's a really, really bizarre system. So that pre-negotiated reimbursements as opposed to charges. It's not like going to the dime store where you pick up something on the counter and it looks like it's going to be $1.50 and you go up and you pay $1.50. It's a situation where the material on the shelves is pre-negotiated in terms of what a third party is going to pay, and that's what's going to get paid. So if somebody negotiated for the same item, it should be $1.50 in this example of the dime store, somebody came along and said, we'll give you $1.30. That's what the transaction will be, and the people that are left scratching their heads are the patients, going, what in the world just happened? And again, probably 90% of patients are covered by some kind of insurance, a little bit of Medicare, Medicaid, and private insurance, and it's all done behind the scenes, and they have nothing to do with it. There is that occasional self-pay patient that doesn't have any insurance at all, that where free market really does sort of work, same as going to the dime store to get something off the shelf. But it does look like, when you look at it from a third party, it is a bizarre system because all the negotiated prices are negotiated well before you come see the doctor, and it may be radically different when you go to one doctor or one hospital to another. So your observation is spot on.
Now, do you think going back to that example of buying something at the store, that United is saying, hey, we'll pay $1.30 for this when Prisma wants to charge $1.50.
Absolutely. And so it's fascinating as it is, Medicare, Medicare and Medicaid, CMS, they set the rate, the reimbursement rates. And so typically what it is with an insurance company, it's a percentage of a Medicare rate, reimbursement rate. So hospital may want 150% of the Medicare rate, and the insurance company saying, we're going to pay you 130% of the Medicare rate for this particular procedure. And that's the way the negotiations proceed. And then they try to meet in the middle, and when they can't meet in the middle, they'll say, well, then deal's off. And again, the sad part of it is this isn't the Screen Actors Guild and you're going to have to watch reruns of your favorite show. This is real life, and this is your doctor, and this is your worry, especially people with chronic diseases that need to be, and it's needless worry often. And I think keep it cool, that almost always these things get settled, and I'm sad that it's gone to this, but in my experience, they almost always get settled.
And I just want to touch on one thing. You say the Medicare rate. So that is really the rate that Medicare would charge for something, and then insurance companies decide, do I want to go to that level or negotiate lower?
Exactly.
Correct?
And I think most people don't understand that, Kara, that the Centers for Medicare and Medicaid Services, CMS, looks at a work unit of a doctor in a hospital and puts a dollar value to it. And they look at that every year, and they adjust those rates based on the Medicare budget. Then the private insurance companies come behind and they pay some percentage of that, usually more than the Medicare rate, and usually sometimes a good bit over the Medicare rate. And there's where the negotiation is. And again, it's reimbursement. It's not if I'm a hospital and I charge $500 for a procedure, if the reimbursement negotiated was $250, they're going to pay you $250. They're not going to pay you $500. And so it's a bizarre system, and it's something that people don't really understand, and it's probably worth a deep dive in a special segment, actually, to talk about medical finance.
Well, maybe for another day.
Maybe for another day, yeah.
All right. Well, thank you so much for joining us today, and we look forward to more segments in the future.
Look forward to being part of them. Thank you for having me.
All right. Thank you.
Good.